Dear brother and sister, today I perform another successfully upward patellar fixation surgery. Before the operation, you can clearly see that the cow was unable to walk properly. The owner contacted us repeatedly seeking help as the condition continued to worsen. This disease commonly causes abnormal movement and progressive difficulty in walking. Many owners are not aware that this condition can be successfully treated through surgery. If ignored, the animal is to suffer for weeks or even months. Before studying, we carefully examined the cow and discussed the condition with the owner. After confirming the diagnosis, we prepared for surgery. This operation was performed in a rural village setting with limited facilities. Before, with proper planning, hygiene and experience, good results are achievable anywhere. The surgery area was thoroughly cleaned and disinfected. Local anesthesia was administered to ensure the cow did not feel pain during the procedure. Both hind legs were examined carefully to identify the ligament responsible for locking the joint. This step requires precision. If the ligament or surrounding structure are damaged incorrectly, the cow may lose the ability to stand or walk permanently. With caution and accuracy, the fixation was gently released and the joint corrected. The procedure required teamwork, patience, and careful handling at every step. After completing the surgery, the wound was cleaned again and antiseptic was applied. If you enjoy real veterinary field case like this, please like, subscribe, and stay connected with our channel. Thank you for watching.